feed. I'm going to be doing enteral feeding on this patient today, and the first thing we want to do before we start is verify the order to make sure there are no discrepancies, right patient, time, procedure, and when we're checking the order, we want to make sure we have the right type, concentration, volume, frequency, route, and rate of the concentration that we're feeding them. And we already have our equipment gathered, and we want to make sure that whatever feeding we use, we want to check the expiration date on it. And then I've got my supplies gathered. I'm going to go in the room and I'm going to wash my hands, identify myself, greet the patient, provide for privacy, and so go ahead and provide for privacy, wash my hands, identify the patient by two means. So I'll ask them their name, their birthday, and check that information with their wristband in their MAR. And I have my equipment gathered. I'm going to go ahead and do my abdominal assessment on this patient. So I'm going to listen to all four quadrants. I'm going to inspect the abdomen first, make sure there's nothing abnormal, distension, anything. I'm going to listen to each quadrant, all four, and as long as I hear bowel sounds in all of them, then we're okay. But if I don't hear any bowel sounds in any of the quadrants, listen for at least 2 minutes. If you don't hear anything at all, wait for 5 minutes. Once you've done the abdominal assessment, go ahead and position the patient to a Fowler's 45 degrees. Okay, and then once you do that, I'm going to go ahead and put on my gloves to get ready. And I'm going to go ahead and verify the placement of the tube so that I can feed them and make sure that I know it's in the stomach. Okay. So I'm going to check all of my markings. I'm going to check to see where it was marked at the nose and check the measurement of that. I'm going to check the measurement of the tube that's left out. And I'm going to go ahead and get my syringe, and I'm going to push in 30 mils of air. I'm going to unclamp it and then push 30 mils of air. And then I'm going to aspirate, make sure it's all in there. I'm going to aspirate the stomach contents so I can measure the placement of that as well, measure the pH. I'll go ahead and pull back about 10 mils of this pH, clamp it. I'm going to measure it with the pH strip that I have, and if it's within 4 or less, then we know it's in the stomach. If it's any higher, like a 6 or more, it's probably not in the stomach, it's probably in the lungs. And then I'll go ahead and push this back, unclamp it. I'm going to pull back all of the stomach contents just to see how much is in there, to see if they're digesting their previous feeding. So I clamp this. I'll go ahead and measure this in the container. Okay. I am measuring how much is going to be in the stomach at the time, and to see what the color looks like, the consistency, and then per agency policy, depends on how much I'm going to be putting back into the patient. So we'll just say we're putting in a little bit per agency policy, and we're going to be putting it back in. Take this off and clamp the tube. And if this were an intermittent feeding, we would do it before every feeding. If it were continuous, do it every 8 hours. And I'm going to go ahead and flush my tubing with 30 mils of sterile water before I put anything into them. So I have 30 mils of sterile water. I'm going to unclamp it, clamp it here, put in 30 mils of sterile water. And if it's, if you're ever doing this for like neonates or anything, you want to do the smallest amount possible to flush with. And then once I've done this, I'm going to go ahead and cap it. Go ahead and take off my gloves, wash my hands and put on new gloves. You can throw those away. So I'm I'm putting on my new gloves, and we're ready to administer the feeding. Now, if it's an open system, like the one here, this bag here, you want to make sure that you label both the bag itself and the tubing. You want to make sure you label it that it's only for the enteral feedings, it's never for IV use, the patient's demographics, the type of feeding, the method, and then the time that you prepared it, and the time of the feeding. Make sure it's hung up on at least a 12-inch pole above the stomach. Alright, so once everything's labeled, you're going to head and clamp the tubing. So you're going to clamp the tubing here, prepare for the feeding, so you want to make sure the expiration date is good. You want to go ahead and clean the top of your feeding container. Pretend this is a feeding container. So you're going to clean the top of this one, and then you're going to go ahead and pour it into the bag. Then you're going to go ahead and prime the tubing once your entire solutions or concentration's in. And same thing for the priming of the tubing. If it's manual, you just want to empty it onto the trash can. If it's by pump, you press the prime button, and then you want to clamp it back. Attach the feeding to both the patient, their tube, and make sure that it's attached here to the pump and everything, and it's ran through. And then once it's attached, you can go ahead and set the rate and clamp, and then make sure it's clamped, and then unclamp it. And then you can go ahead and flush with 30 mils of sterile water. Alright, so once you're flushing with 30 mils of sterile water, you want to make sure that you do both the tubing of the patient, and you want to do the bag and the tubing to make sure that it's rinsed out. And then you want to clamp it back. Cap it. So then you want to disconnect the feeding once that's all done. So yeah, just disconnect all of it, and then once it's all disconnected from the patient and this is clamped back, keep the patient up for at least 1 hour after the feeding. And so that's for open system. If you're doing a closed system, it's a little bit different. You're going to check the expiration date also. Make sure that it's labeled the same as with an open system, both the container itself and the tubing. The only difference with this one is you have to spike this one with the tubing, and then after that, same thing, you want to prime the tubing the same way. If it's manual, let it drain to a trash can. If it's pump, press the prime button, and then make sure it's connected from this to the patient, and make sure the patient's hooked up to this and it's run through the tubing on here and the pump. Then you're going to go ahead and set the rate like you would with an open system, and then disconnect it once you're done from the patient. And then once the feeding is over with, you can go ahead and flush it again with 30 mils of sterile water to make sure it runs through all the way. And cap it. Put 30 mils of sterile water in. Alright, so clamp this, put this back, and then you can connect the cap back onto it once they're done with their feeding. And the main thing you want to do before you do any kind of a feeding is you want to make sure that you just kind of trace your tubing and everything to make sure you're putting things back in the right spot and everything. And also you really want to label your bags and your tubing and make sure you do that so everyone knows, especially that it's not for IV use.